back. It's still Morning Rush on Metro Television, and this morning we are talking about UTI, urinary tract infection, and we have Dr. Sherif OKYERE, who is an alternative medical practitioner from Scientific Herbal and Alternative Medical Center. I got it right.
Yes, you got it right.
Don't worry. Good morning. How are you?
Good morning. I'm doing well. Yourself? Yes. So it's a pleasure to be here.
Yeah. Today we are talking about one of the common infections in women. It's mostly common in women. Yeah. And I think by the time Doc leaves here, we'll get a solution to our problems. Yeah. But basically, when we talk about UTI, what exactly is it?
Thanks so much for the opportunity. UTI, first and foremost, we need to understand what the urinary tract is actually about. It comprises the urethra, the bladder that holds up the urine, and where urine is produced, that is the kidney. So if you are talking about urinary tract infection, it's been categorized into 3 phases. Okay. So the stage where the infection happens within the urethra, that we classify it as having urethritis. There's a case where the infection happens within the bladder. We'll classify it as having cystitis. And a case where the infection will actually ascend or travel up to the kidneys, where we say you have pyelonephritis. Okay. And it happens when you are exposed to a specific, bacteria called E. coli, Escherichia coli. When it gets into any of these tracts, either the urethra, the bladder, or the kidneys, it causes inflammations within the lining of these organs, and it causes, these infection. When this infection happens within these tracts, that is where we say you have urinary tract infection. You mentioned that it is common in women. Yeah. And the idea behind that is the fact that when you look at the anatomy of women, first and foremost, their urethra is shorter than that of men. Okay. You understand? And the mere anatomy of how their orifice, the openings are, it predisposes them in getting UTI in them more than it happens in men. Okay. But of course, men also do have urinary tract infection.
Yeah. Okay. You said bacteria that you are exposed to.
Yes.
Those bacteria that we are exposed to, where do we get it? How do we come in contact with it? And is it both men and women that get in contact with those particular bacteria?
Yes. So what actually happens is about 90% of all urinary tract infections are caused by E. coli. Now, E. coli are, in their normal habitats, they don't cause any problem. That is when they stay within the large intestine, around the colon and all those things. So you realize when you visit the toilet, you have a tendency of, disposing some of these bacteria through the feces. Okay. You understand? So in the act of cleaning yourself and all those things, that's why I mentioned the anatomy. A lot of times you see people cleaning from the back to the front. Oh, so the mere fact that you are cleaning from the back to your front, you expose these E. coli into the urethra or into the tract, and it can lead to this infection. There are situations where maybe mere fact you don't clean your hands well, maybe you're having an encounter with your wife, maybe your hands get there, you expose this infection to some of these things, and it can cause some of these things. There are situations where there's immunocompromise some way, somehow within the system. The immune system becomes weakened, and these infections, actually happens, and it causes. So mostly, we get urinary tract infection by not properly, paying attention to our personal hygiene.
Okay.
You understand? Because the bacterials or the E. coli are always going to be in our large intestine. They are always, that is their habitat.
Okay.
And they act, there's a purpose for them in there. But then if they change habitats, when they move from the large intestine into the urinary tract, that is when they cause these problems in the system.
Okay, so so what you are saying now is about the woman.
Yes.
Right? I just want to understand how the urinary system is.
Yes, okay.
Right? So that we can appreciate how important it is to us.
Good.
And why we should, make sure that it is in good shape.
Yeah.
Okay, so the urinary tract, from up down, we have the kidneys where urine is being produced. Now, the kidneys excrete waste substances, from excessive fluids, waste substances from the blood and all those things. And then when urine is being produced within the kidneys, it moves down into the bladder where urine are stored.
Okay.
You understand? So urine are stored within the bladder so that when you have the urge, then
You're able to go.
you'll be able to void the urine. Now, when the urine is coming out, it passes through the urethra.
Okay.
Mind you, women have two orifices, two openings.
Okay.
You understand? Women urethra is different from the vagina. That is, yes. But for men, we have the same
One.
We have one opening.
Okay.
That is the one urethra. Now, in cases like in men, when you have issues like BPH, that is when the prostate becomes enlarged, and you're having challenges with your pee, your urine, and all those outputs are not proper, and your what we call the post-void volume becomes very high. There's what we call reuptake, reabsorption from the kidney, because you tend to, the remains of the urine in the bladder becomes small. So the mere fact of reabsorption of these fluids can also establish what we call the pyelonephritis. Because right now the kidney is resorting to this waste that is supposed to go out from the system, and it can establish pyelonephritis in men.
Okay.
You understand? And then also with women, because they are, of course, their bladder, their urethras are shorter, and although they don't have prostate enlargement and all those, but their chances of being exposed to the E. coli infection is also very high, and that is how come the infection happens. And then also realize that not just the adults, UTI is also very common in young children. You understand? Children, you understand?
Okay.
Yes, so especially cases where children are in diapers and all those things, you see, they'll pee in the pampers, they'll go to toilet in the pampers,
yeah.
and then they'll be in this situation for a long time before it's being changed. All these things can also cause, urinary tract infection in children.
So for the urinary system to work well, I wanted to know the main, so from the kidney,
Yes.
the bladder,
Yes.
the
urethra.
the urethra.
Yes.
These three are very significant
Yes.
in helping pass urine.
Yes, it's very, very important, and they are all very, very important organs. You understand? For both men and women. Talk of the kidney. We all know the importance of the kidney. It's enormous. We can't even mention them. Very, very important. Same as the bladder, because that is the storage where urine are kept, and at some point it has to come out. The urethra also serves its purpose by helping you void urine when necessary. So they are all very, very important organs, and any sort of infection in any of these organs could cause a lot of problems to the system.
Okay, so before we talk about the symptoms and the treatment, so it means that since it's sort of like it has a place in our lungs, it does, when there's urine retention, it doesn't cause it doesn't cause any sort of urine retention. Infection, as in the urinary tract infection. My question is, does urine retention causes urinary tract infection? Since the explanation you've given that it is found there, so since it's there, it has nothing to do with the fact that we are keeping urine and that it will cause that infection.
The bladder is actually a temporal storage for urine.
For the urine.
It is not a permanent storage for urine.
The urine.
So as and when the bladder becomes full, that is when you have the urge. And the moment the urge comes, you need to void the urine out. Ideally, there are mechanisms, at some point when you void urine, there should be just a little or no urine left in the bladder.
Okay.
You understand? The moment where the remains of urine that are left within the bladder after voiding or after urinating, it becomes a problem.
Okay.
So it means that there's an incomplete voiding of urine in the bladder. And the mere fact that, because it is waste substance, the mere fact you keep waste in that place for a very long time could cause a lot more problems to them. So you realize in men who have issues with prostate enlargement and all those things, have a lot more infections within their urinary tract than people who don't have those issues.
Okay. So how do we get to know that we have UTI?
Yes. So usually the symptoms or the signs are around your urine, how you pee. You see people complaining of urinating frequently because of the inflammation that has been caused cause a lot more irritations within the bladder. So even when little urine comes in the bladder, because of the irritation that has been caused, you have the urge to go and void it so that you'll be fine. People who have burning sensations, pains during urination, what we call dysuria. At some point, you feel when you urinate, there's still some remains of urine within the bladder. You want to go again and the likes. In severe cases, you see people urinating blood, or called hematuria. Yes, it could cause that. Urinary tract infection could cause problem, what we call lower back, especially when it happens at the within the kidneys, pyelonephritis. So you're always complaining of lower back because that is the location of the kidneys. So you always feel pains.
At your back?
Yes, at the back.
So those who have pains at their back, it's not your belly.
It is always not the back. Urinary tract infection can actually cause some of these things. And then there are some people, after sex they get unusual pains within their genitals. When you have issues with, what do you call it? Urinary tract infection, it could cause that. There are people who are having chills, nausea, and fever all the times. They've been treating malaria, typhoid for a very long time. They are always exhibiting these signs.
Wow.
Always having fever, they are always feeling nauseous, and they are always having chills. And in Ghana, when you're having fever, chills, nausea, and all
malaria.
The first thing that comes to mind is malaria. But urinary tract infection can also present some of these signs and symptoms.
I usually like to touch base with the people, because you deal with them on a daily basis. I mean, there's the book part, and there's also the one where when people come to you, to your outfits, what are some of the things that you see with respect to the urinary tract infection, even the understanding of it?
So, usually, when a woman is there, for example, with women, when they are urinating frequently, burning sensations and all those things, the first thing that they feel probably there's some sort of infection, and mind you, in severe cases with UTI, you can discharge. But it is not the first line of symptoms that you see. But in severe cases, you can see discharges coming out from your genitals. So if you're having some of these signs, burning, discharges, and all those things, maybe I have candida or maybe I have some infection, especially when they've engaged in unprotected sex within that period of time. So they tend to resort to, you know, medications that are not serving that purpose.
Okay.
You understand? Because the sort of medication that you need to take for urinary tract infection is totally different from what you probably take for a candida infection.
Yeah.
You understand? So you see people taking medications and symptoms keeps increasing and in effect because it could cause a lot more damage because people have suffered severe problems, strictures. When we say urinary strictures, that is when your urethra is closed up, and when it happens that way, we have to surgically work it out for you before you can actually pee. Some people are having bladder stones as a result of, you know, UTI. People are having kidney problem, chronic kidney problems as a result of, you know, urinary tract infection. So it is one thing that we need to pay attention to. And when you are there and you're having any of these signs, the best thing is to go to the hospital, get checked to actually identify that, okay, it is UTI, so that we can give you proper treatment to some of these things.
All right, so talking about the hospital, you know where to go. I'm in Scientific, and we've been talking about this always. So get to their locations. Dome Smith Flats.
Yes.
There's one there. That is in Accra.
Yes.
And one at Klagon.
Yes, Lashibi Klagon.
Okay.
Close to the Ashaba.
Across the country.
Yes.
Across the country, every corner of this country, you find Army Scientific there, and the numbers on your screen. Just call them, sort this thing out ASAP, so that you do not get into some other trouble. Not that because the hearing is here, also. You can anything that it has to be sweet crowd then to sickness. All right, so Dr. Sheriff, thank you so much for coming. And as always on Wednesdays, you'll be here talking to us about our health. Very, very important. So today we're talking about urinary tract infections. If you heard about it, call them, let them sort it out for you. I'm in Scientific. Then what's the rest? Now the name?
I'm in Scientific Herbal and Alternative Medical Center.
Fantastic. Yes. What's the again?